Hi, this is Jason Salami. I'm an associate professor of epidemiology at the University of South Florida College of Public Health, and I want to put together a very quick video. I'm getting asked all over the place what happened recently with the CDC, Florida Department of Health, snafu with the numbers. Why was there an error? What happened? What underlies this? And so, this is my very quick attempt to try and explain exactly what I think probably happened and explains what we're seeing. The big thing is this is not a battle between what CDC comes up with for the numbers versus the Department of Health. All of the information originates with the Florida Department of Health. This is their numbers. It's just how those numbers are processed and reported that seems to have had a snag. So I'll try and explain this very succinctly. So, on a typical weekday, right, let's say that right now the CDC's total number of cases for Florida is 2 million, and the total number of COVID 19 deaths that it has is 50,000. This is cumulative to date. And now they're going to receive a new dump of information for Florida. Florida is just reporting to CDC revised total numbers. And so we get 2,020,000 in terms of cases, 50,060 COVID 19 deaths, and all that the CDC has to do in this case is subtract those two. And we say, well, we learned about 20,000 new cases and 60 new deaths. Hopefully that makes sense. Now just focus on the revised current total because on day two, right, that's what the CDC is starting out with, those new totals. And now they're going to get a report from the Department of Health. Same exact thing. They're going to subtract the aggregate numbers and say, okay, we had 15,000 new cases that were reported from the Florida Department of Health and 40 new deaths that were reported. So, what about on the weekend? Because this exact process doesn't happen every day during the weekend. What ends up happening is this is now over 3 days. The CDC does not receive a report on Saturday or Sunday, so they wait until Monday. And that report, usually that new aggregate number, so look at the aggregate number being reported by the Department of Health there on the left. Now, what the CDC is going to do is the same exact thing. They're going to subtract the cumulative numbers and they're going to say, well, we've now had 55,000 new cases reported, 120 deaths. But this is for a 3 day period. So the CDC will then take that 55,000, divide it by three, and evenly distribute it across the 3 days over which that reporting was supposed to cover. And they'll do the same thing with the deaths. So 120 deaths over 3 days. On average, that's 40 per day. And you would see this in the CDC data repeatedly. You would see over the weekend three numbers that are almost identical. It is not because there was almost identical number of cases that occurred on each of those days. That's just the average based on what we're seeing here. So hopefully that makes sense in how they were processing the weekend numbers. So it then begs the question, what went wrong? And again, this is my speculation. But let's take this total here, right? And this is the report that came in from the Department of Health, same thing. And they still saw those same numbers 55,000 over 3 days, 120 deaths over 3 days. But my suspicion is timing is everything here in the algorithm that's applied. And maybe the timing of this made the CDC feel as though maybe this is only 2 days and not 3 days as it usually is. And my guess is all that they did was they divided the aggregate number instead of by three, they divided that aggregate number by two and reported those total counts, the averages, as though it happened across 2 days. When in actuality, nothing had changed. It was still a 3 day total. That was the difference in the cumulative numbers, and it should have been divided by three. And you can see this bear out if you take the original numbers that were reported. Obviously, these are not the exact numbers. But if you took the numbers that CDC reported across 2 days and you added those up and instead divided by three, that was closer to the average across those 3 days. So I think it really was as simple as that. It's an easy error that can happen. And I'm sure that what was transpiring today was a lot of back and forth between the CDC and the Florida Department of Health to make sure that they understand exactly what's being reported, when it's reported, and hopefully this never happens again. So that's it. Just wanted to put something together quick. Again, I don't know. I don't work for the Department of Health and I haven't gotten a response from the CDC, but I kind of know how these numbers end up getting reported. And this is the only thing that really makes sense as to what happened. So I know this isn't very exciting or there isn't a lot of controversy. It's just a really simple dividing by the wrong number kind of issue. And thankfully, earlier today or last night, I forget exactly when it was, the numbers actually got rectified and we're back on the right track. So I hope this helps to explain what most likely happened with the error. And again, I'm sure that they put steps in place so that this doesn't happen again. All right. Thanks, everybody, for your time.